All right. Well, welcome everybody. We're excited to have you guys here today. I'm gonna welcome the guys that are here. I just want to say, hey, David and Jeff, we have 20 plus agencies in this interagency briefing, and we also have folks from industry that are interested in this topic for helping serve the government. So we appreciate you guys joining us today. Quick disclaimer, this event's not endorsed by any agency, and it does have a participating vendor with micro distributing, right? Right, micro distributing. And all participation is voluntary by you, and it's not an endorsement or commitment to purchase from any vendor, which is important because that's what GSA has. This is actually a GSA piece. GovBrief does these all the time. We appreciate you guys joining us. It is being recorded, so we'll distribute that later. With me, I got Jeff Milner. He handles the ERAM-X. We'll talk a little bit about that. And David Wilkes from Micro Distributing. Welcome, guys. Appreciate you guys joining us today.
Thank you for having us.
You bet. Hold on one second. Put the do not disturb on. We love participation. Since we have 60 folks here, let's do us a favor. Any of your questions or anything, you can raise your hand. We'll do the interaction. Pop it in the Q&A. If you have something that you don't want everybody and their mother to see, you can send it to davidw@micro-distributing.com, or you can give him a call right there, but don't do it during the session because that'll get him distracted. Right, David?
Please don't. Yeah. So many things.
So there you go. We love feedback. In fact, I'm going to test to see if you understand how feedback works. You can pop that reaction button. If you can do me a favor and click on this, and this goes to a work drive that you can collect this. Fantastic. I love it. Let me know if this is actually working, that you can get to these. If you can't get to these, some of these get blocked. We'll make sure you get these in some other way. Just let me know. Getting it? All right, fantastic. That's what it looks like. Looks like we're in business, David and Jeff. All right. And then the other part that we're going to do today is we're going to ask things like, why are you here? What made you decide to be here? You want to get your head around this virtual drug testing thing? Maybe you're responsible for administering drug tests. Maybe you're trying to get efficient. That seems to be a word of the day, huh? Anybody heard that word recently? that can be a bad word. But we want to get efficient and save dollars. Virtual drug testing is what you need. I love that idea. Or your boss made you come. So we know there's going to be some folks answering that question that way. And if you've ever been to a GovBrief session before, we always love to have folks that are new. It looks like most of the people are new. So that you got a hot topic, David Wilkes. You got yourself a hot topic here with a whole bunch of new folks coming in. And just so we hit this right, let's make sure we get this for everybody. Number one, Allison's asking, learn more about drug testing and newer innovative ways to complete drug testing. I think that's what this is all about, right, David?
That's right.
Yeah, buddy.
Exactly.
And Austin's asking, requirements are explained. We'll talk a little bit about that, and implementation. We'll even talk about that, right, Jeff?
That's correct.
That's the idea. All right. And discuss the changes from pre-120. I don't know what happened on 120. I don't know. Just kidding. And the new executive orders, drug-free workplace, where we will have those. All those are in the handouts as well. Kenneth, potential sources for the oral drug test were already identified. We have one here, and there's some certainly some things that you guys do because you have patented technologies. That's why you're here. Wendy from Arbor Research and Collaborative for Health, a recording of it was shared. Best briefing ever if it's being recorded. Guess what, Wendy? It's being recorded. How about Frank? It's functional. We'll keep it functional for you, Frank. Kristen, it helped to expedite the pre-employment process. What do you think, David?
It will definitely do that.
There we go. And Tim wants to know about federal administration or law was cited. Yes, it is. It'll be cited and actually distributed. All right, here it is, guys. We're going to address the firms or plans getting oral drug abuse for telehealth or home use. That's you guys. So we're going to address that for sure, Allison. Bill from the Fiscal Service, federal requirements and costs. Will we get into costs, at least at a high level, David?
Yes.
We'll talk about some of the comparisons there.
Sure.
Fantastic. How about drug testing for truck drivers? I think you have a case study for that, don't you?
We do.
We'll talk about what we can do, we can apply this testing method to, for sure. Yeah.
Awesome. And we'll talk about how long it takes, the oral fluid, general information, how to get randoms. So randoms and post accidents. There's two other places, right? So randoms and post accidents.
24/7.
24/7. Love that. And then commercial availability, because that's important, and FDA requirements and approvals. Kenneth, might pop you open for a minute if you want to dive down into that a little bit later. Make sure we hit what you want. And testing for drugs, because that's what it's all about. We will do all of those things, I think, right, guys?
Correct.
Awesome.
Yes.
So I'm going to end this poll in about 10 seconds. So if you haven't had a chance to let us know why you're here, let us know why you're here. In the meantime, we're going to get you a couple of things coming your way, including the session docs for those who have just popped in. But we're talking about the initiatives. That's the law and the administrative things that are being driven down for drug testing, and talk about traditional versus modern, because that's what we're about, right, David?
That's right.
Is letting them know about that. Efficiency and cost savings, huge issue now. We want to drive that, help you drive that. One of the things that I love about GovBrief is we talk about what's hot, and this is hot. Efficiency is hot. Whether you agree with it or not, it's hot. Drug testing case studies, we'll talk about that in virtual drug testing, and then talk about that increased productivity. Next steps of how you can implement this in your agency and get more information, as well as some closing remarks from those guys. The session docs that I just put in here, you will find a bunch of them. It started back with the Reagan administration. You can see the one that's kind of old in the background there. That I had to pull that down from the Federal Register so that you could have that. All that is in the handouts. So if you haven't gotten those handouts, that's what I just posted in just a couple seconds ago. All of that information is there, including the briefing presentation. The one thing I didn't include is this. This I put the link in here for you in the presentation, because it's not really a handbook. It's not in a PDF. So you can grab that from this link right here, and also by downloading the presentation, as well as micro distributing's capability statements. So as we end this poll in 3, 2, 1, any last minute wallflowers want to participate? Okay, here we go. All right, guys, here's what we got. 64% trying to get their head around this whole idea. Love it. 23%'s next one. Efficient and save dollars. Hey, we want to be able to do that. And the rest of those 15%, they're responsible for administering those, and they know that they need virtual. Love that, right, guys? We'll make sure you get what you need as far as testing and things like that. And 84% are new. Appreciate you guys answering those things for us. So David, tell me a little bit about micro distributing and how you guys got started and what you're up to now.
Sure. Thanks, Dave. And thanks everybody for being here. We are a Texas-based drug and alcohol testing company. Got started back in 2000. So, we've been in business 25 years. We were kind of born out of the DOT regulations, a sister company that was kind of doing HR consulting when all that hit. And one thing led to another. And, our company was born kind of when instant drug testing kits first became available on the market. And we became more of a distributor for those types of tests. We do have our own brand, our own patents that we've designed of our own. We call our stat test brand. We have urine, saliva, and hair. We also distribute laboratory analyzers and reagents. We're a consortium and third-party administrator. We do a lot of DOT drug and alcohol testing. We work with certified laboratories, medical review officers, nationwide collection network. We have some clinics, mobile collectors, et cetera. And now, the newest thing to our lineup is what we've branded StatLive in partnership with ERMX, which is the virtual drug testing technology we're going to talk about today. The ERMX is, of course, the platform that this virtual test gets conducted through. We supply the test kits. We are the virtual proctors. Our proctors are DOT certified and trained collectors in urine collection and oral fluid as well. But they go through additional training for how to apply the technology to a collection. Right now, we are, as far as we know, the only ones doing this 24/7. And it's really important that you guys know that this platform, this technology is patented as well. So we're really positioned in a very unique way to combine the oral fluid instant testing and the virtual drug testing together. We'll talk more about it in a minute, but this is a mobile platform, so it's with iPhone or Android device.
I think that's really interesting. I'm interested in hearing more about that, especially when it comes to the patented piece where you're taking control over the smartphone of the person that's taking the test, right? So you're watching it real time.
Yeah, very much. Of course, they have to give us permission to do that, and that is part of the process. But yeah, once we are connected, we can control. For example, we can control the flashlight.
That's crazy.
In the camera. So
that's awesome.
So yeah,
I'm really interested in that. Fantastic, learning about that part. I never heard of that before today. Being able to take that control. I think there's going to be a lot of other applications that other agencies are going to be interested in for that, just outside of the drug testing at some point. All right, so real quick, I got this next poll, which is what type of drug testing are you doing? You mentioned a couple of those, right, David? Urine, hair, oral fluids, what we're talking about today, or maybe you have a different one. And what are you using it for? Because there's a lot of different ways that you can use this. Pre-employment, random, maybe you're using all four. Pick as many as you like. And for cause or post-incident and accident or reasonable suspicion. So let us know about that. And while you're doing that, I'm going to do a high-level overview of some of the executive orders and some of the regulations. Because one of the things is how do we know that we can do this? Because it is legal to do, right, fellas? It is legal.
Correct.
And so for the folks, there's a couple folks who were asking for, hey, what is it exactly? Well, here they are. Executive Order 12564 goes all the way back, as I mentioned, to the Reagan administration. You can see the sections here for being able to test for employee use. I'm not going to read all these, but I will say that some of these for being able to test for illegal drugs, accident or unsafe practice, right? If there's post-accident, as we're talking about here, and as part of a follow-up counseling, or if you have to do randoms, right? That's where the randoms come from. And then we have, this is really the key. One of the good things that came out of COVID, right? If you could ever say such a thing, right, guys? But yeah. It established a precedent for using the type of technology that Jeff and David have created. Same kind of thing where you're doing virtual examinations, right? We saw that tape where you're using iPads and other things to be able to communicate to patients. Same type of environment. So that's the precedent for doing the same type of testing that we're talking here. Everybody tracking with that? Thumbs up if you're tracking with how that's working. Just want to make sure you're getting that. That's where we're coming from. Got it. Fantastic. So then we have the brand new one, which is for the efficiency, right? And if this is one of the hottest things right now, to be able to justify how you're going to do things in the future, right, guys? We're seeing this all over the place, and being able to maximize efficiency and productivity for Department of Government efficiency, right? So let me end this poll in 3, 2, 1, and here we go, guys. Let me see what you think of this. 84% are doing urine. Is this what we would normally see, guys?
Yeah, not
Right.
surprised.
A lot of folks don't even know that oral can be done, right?
Well, it's new. I mean, the terrain has changed somewhat over the last few years, and urine has been the traditional way of doing it, all the way up till being published in the Federal Registry, the acceptance of oral fluid by DOT. That really validated the science of oral fluid, which has been pretty solid over the last decade, wouldn't you say, David?
Sure, yeah.
Yep.
They've been kicking that around for over probably almost a decade as well.
Yeah.
And that's in your handouts too. That what you just talked about from for the overview of using oral fluids is in the handouts too. So let's talk about what that is. What is oral fluid testing? Let me get rid of this here. Oh, by the way, pre-employment is the number one on this, but everybody is still using it for other things too. So we appreciate that very much. And so give us an idea, David. How does it work for oral?
Well, and let me preface this by saying that we're talking about, there's two ways you can test oral fluid too. We're talking about instant testing today because it's all about efficiency and all that with the virtual technology. You can test oral fluid via laboratory, direct to lab, but today we're talking about instant testing. So I'm going to kind of be heavy weighted on that, but obviously it's the saliva sample that you're collecting. It's done with a sponge or some type of device that you swab the mouth. It can take up to a few minutes to do it, just to make sure that enough is collected, because that's the key, is getting enough saliva collected. So it's quick, easy to collect. The donor kind of does the collection themselves with instructions. So, a collector doesn't even have to, they're not the ones putting the sponge in their mouth. They do it, the donor does it themselves. So it's very uninvasive, compared to, a bathroom situation or, blood or, anything like that, or cutting someone's hair. So it's, as far as all the methods go, it's definitely the least invasive as far as collection goes. And there's no, it's not a gender specific type of situation for the collectors. It's directly observable. I mean, one of the biggest problems in drug testing is specimen validity, especially with urine, and all the things that people do to try to tamper with their tests, substitute their tests. I mean, it's almost $1 billion industry, just the products alone that they sell to trick drug tests. So with saliva, that's virtually impossible. There's also not that they don't try to sell stuff, but the mouth is kind of like a self-cleaning oven. So there's a kind of a nothing in the mouth kind of period of time while we're kind of talking to the donor and kind of instructing them, that during that period of time is enough time for the mouth to just sort of clean itself out naturally from anything they may be trying to do. Obviously you can get results in minutes, and I mean, when I say minutes, I mean just a few minutes, literally. In some cases 1 minute can be that fast. We use these, in non-regulated workplace testing. You can't use instant testing for DOT, truck drivers. It's all laboratory based. And the new regs that came out, it's a laboratory based oral fluid test, but it is oral fluid. But unregulated workplace testing uses instant tests all the time.
Cool. And so we do have a question of how hard is the collection from Allison?
It's very simple. There's obviously, you see the sponge, and the instruction is typically to put it in their mouth between their cheek and gum, and it needs to be kind of an active, swab back and forth. The proctors will instruct the donors to kind of switch sides. They'll kind of time it. They'll ask them at the very end to put it under their tongue, because that's where saliva will pool, and that'll be kind of the last place, before taking out of their mouth. Really important that we instruct them not to bite or squeeze the sponge, because that would obviously defeat the purpose of collecting saliva by squeezing it out. But we will use up to 3 minutes to do that process. Just it's usually more than enough time, but that's just an insurance to make sure we get enough. It's because if these devices don't get enough saliva collected, that's when there's a problem with just getting the strips to fully saturate. That's the key to the performance of the actual test. So
then once that's done, it's pretty simple here too. And
right, it's kind of like reading a pregnancy test. Most everybody's familiar with the concept. If you've never done an instant drug test, it's real similar. There's two. You read, the strip has 2 lines. The top line is called a control line. Just means you want that line to appear. That means the test was saturated well. And then there's the test line below it, which is the actual drug that we're testing for. So if a line appears there, or even a faint line, it's considered negative. If it's clear in that region, then it's indicating that it detected a drug. If a line doesn't appear in the C region, that means it didn't wick properly. It's invalid. So that's what we definitely try to avoid by having a good collection, a good trained proctor leading them through the collection.
Awesome. And Rena's asking the question about being costly. We're going to talk about that in a little bit, right? We're going to do some comparisons.
Sure.
So when you compare what is traditional and the challenges that happen, take us through this for the for each one of these, for each one of the collection.
Well, with pre-employment, and this goes for really any reason testing. I mean, lab results can take up to a week. I think there's a slide here in a minute that also kind of just shows the whole process of, if you're going to a clinic, if you've got to, see what hours they're open, you've got to drive there. If it's a walk-in clinic, you may have to wait 2 hours. And then they're going to ship it off. They're not a lab. They're just a clinic that's collecting. So they're going to pack it up, ship it off. There's a day or 2 shipping, and then the lab's going to take a few days, and sometimes longer. So just, speed alone, and then just efficiencies with that person's time as well. We're gonna be able to avoid all that. We can do this virtual test within the instant test can take a couple minutes. The whole process with the virtual is around 20 minutes before someone will get a result in their email box. So very fast. For cause or reasonable suspicion, post-accident, all these things are incidents that can happen. These are the 2 a.m. Incidents that happen. This is the biggest challenge in drug testing. Where do they go? It's not like your local clinic is open, and then you're dealing with emergency rooms or some. They're not all 24/7, and some of the 24/7s don't do drug tests. Or they'll do some testing that's outside of your protocol. So this is a way to kind of keep it all consistent and be available, to do it, 365 days, 24/7.
And you have a couple case studies that you're going to talk about where you can have these on hand
Right.
to do the randoms, to do the safety site tests as well, right?
Right. Yeah. And like with the randoms, there's, in these instances, you may have 10, 20 or more that you need to test. So, we can just coordinate with you. We've got a lot of proctors, so we can do, we can be doing multiple tests at the same time. And, we can work with people to just kind of coordinate those so that they get done as fast as possible. And again, depending on the situation, don't have to leave the work site to do stuff. They can just take a matter of minutes and they can go back to work.
Provided they pass.
Yeah. We can
Well, you
talk,
don't want them back if they don't.
That's right.
we'll talk about.
And you want to know you want to know quickly too.
Yeah, right. I mean, because you're trying to, well, if it's post incident, it might be too late. But if you're questioning with reasonable suspicion, you can avoid a whole lot of problems. That's
Right.
Well, if it's post incident and you're getting a presumptive positive, it's not too late. You're responding to something, but if you put them back on their site without knowing, the liability is spiked tenfold over that.
I can imagine.
And we do work with people to kind of customize the protocols. I mean, emails will go out, but we can do phone calls as well to the designated employer representatives. We can have our proctors, give phone calls so that people know. But one other thing that's a little different, but we've run into some customers that employees have to be. It's not really random, but they have to have a test every so often, say maybe every 90 days. To have access to a site, and they may get called in based on their whatever their job is, to go to a site, and they haven't had their test. It's not up to date, so they can't get access to the site. This is the way we've helped them kind of solve that problem too.
That's awesome. So one of the things you mentioned earlier is that this is all virtual, but it's confirmed. How does that work with, take us through the process, because you were using the remote donor. So if I was the donor, if you're testing me, how would that work?
Well, there's a lot of stuff that happens at the implementation or the launch setup kind of stage where we have to kind of really understand how the customer wants to use it, because some people will have the test kits on site at a job site, ready to go, all the supplies. And since we're kind of already talking about, you mentioned confirmation, those are additional supplies as well. I'll back up one, since it's kind of already come up on the confirmation, because if there's a positive on an instant test, that's an initial screen. It's not a confirmed, drug testing is a 3-tier process. There's an initial screen, a confirmation, and a medical review for a positive test. So you have the option to kind of do the whole process with us, or you could, once you get alerted that there's been a positive screen, you could revert to an in-house policy or an in-house, vendor or some other, testing situation that you want to back it up with. So there's options there. But regardless, just want to emphasize the point that the instant oral fluid is an instant or a preliminary screen. But another way people use this is that we will send kits to people's houses. So in that case, it may take depending on how they want us to ship it, overnight, second day, we can ship, we can rush or ship normal. There'll be a follow-up once they receive the kit. But once we kind of have all that ironed out, what all they want to do with us, you'll be given an 800, our phone number. Basically, we have a designated phone number where people can call us at any given time and request a test. Or if it's more of a scheduled type thing, like a random, sometimes we'll be in communication, getting that planned, kind of set up. So it's however people want to use it, but once they reach out, the phones are answered 24/7. Our normal hours are obviously going to be a little bit faster. Our after hours, we have an on-call team that rotates because, it's not as busy, obviously, but equally as accessible. And then we'll walk the person through downloading the app and making that connection that through that secure server. And once we're connected and we're communicating through the platform, they can initiate the test.
So when your medical observer, I have the app on if it's me, I download the app, I'm connecting to the server, and then I'm talking with somebody on the other side that's going to direct me, just like you said, 3 minutes, swishing, doing all this stuff that you said, right?
Right.
And I'm fascinated by that, because you're actually taking control over the phone. I would give you permission to take over my phone. Is that right?
Permission's the key word there. The cameras, front or back camera, the microphone, the geolocation, if our customer prefers that be left on, that capability. But it's not a willy-nilly app. You couldn't get through, for example, iPhones. You couldn't get through their development, their approval when you're developing an app if you can open it up willy-nilly.
Right.
They have to open the app up. They have to give you permissions to register the app, first of all, and then each observation. If it's going to be someone where there are recurring tests, they can stay in the system, but they have to acknowledge each observation and allow that to be opened. And if they don't, if it's scheduled, then that's an absent test. I mean, there's a lot, like David said, through the onboarding process and everything that's discussed as far as what the agency's protocols are and what they want the trained proctors to follow, the instructions.
Yeah, and I will say, as a follow-up, and we'll get here, after this call, if people are more interested, the best way to show how this works is a demo.
Yeah.
Because obviously it's technology, and we can show you what the donor sees. We can show you what the proctor's seeing, how the two are working, side by, at the same time, simultaneously, and how the test works. But
So after hearing all that, what are your concerns about virtual testing? You can just type in a little bit of an answer, because we want to get an understanding, because you have the whole layout of getting the test to you, right? That's one of the pieces. And I think what's interesting is you can formulate that based on what the agencies need, right? If they say, hey, we have a fleet, because we're going to talk about that in a minute, right? If you have a fleet of folks, you can actually get that in the field. They already have them. And then if there's something that goes wrong, you have access to it. Or with an employment or pre-employment, you're sending it to the donor, and you have a process to handle those. Really,
it can be the donor, or it can be the donor or the employer themselves. They can warehouse the tests. There's a lot of different ways. And you touched on something. Bottom line is that onboarding process is about customizing to what that agency's needs, that company's needs are. And that's what we do. No two programs are exactly the same. So like David said earlier, we need to know how they intend to use it, what they intend to use it for, what hours, how they want the kits shipped. They're shipped in boxes of 25. If they want to warehouse the kits and hand them to the individuals, they can be shipped regionally, individually, overnighted. Micro distributing, they're also subject matter experts in shipping. They ship out an ungodly volume of test kits daily, weekly, annually, 24/7. So that's important too, because that's all under one roof. There's no delays in getting kits shipped from one company, getting a test proctored from another, and then using someone else's technology. We have all this positioned under micro distributing under one roof. It's fast.
So, and there's other folks like Julie. I know that they do drug testing. So there's the secondary pieces. So yours is preliminary. At least this part of it, right? And then you, like you said, the agency or the organization can have a different protocol for finalizing, right?
And they can use micro distributing A to Z too for the confirmation process, all of it. They can park it all under one roof.
Got it. All right, we're going to shut this down in another couple of seconds. Any last minute concerns, you pop that in. We'll open those up in just a minute. Give us an idea. So the Stat Live that you mentioned earlier, the 24/7 nationwide, you mentioned you can ship it anywhere you want. And the mobile app, you were just saying, it just goes, you go to the App Store. Is that the kind of thing?
Right.
Correct.
And I'm amazed at this with the results in 20 minutes, because a lot of times it takes days, right?
Typically 3 to 5 days minimum.
So it can take up to 2 weeks, I mean, for people to get results. Yeah.
And go ahead, Jeff.
But Dave, I also want to mention, it's compatible with iPhones and Androids, but that's all generations of those devices that are still supported by the manufacturer. So every new device that comes out every 6 months, we're testing every new device, but we're going back generationally to really old generations of phones. If Apple is still supporting an old iPhone device, our app will be compatible with it. So you're casting a wide net over users, donors, and we specifically targeted a mobile app because, for exactly that reason, oftentimes they're mobile. We've had people pulling off the side of the road somewhere safe and being tested on a random test. The flexibility of that is tremendous.
So give us an overview of this, of what it looks like when you're this is the login screen. What is this we're looking at?
That's a result. Coming back, David mentioned it takes about 20 minutes to get a result. That's an automated result that can be sent out to as many people within that agency that have permission to receive that result. We actually have 7 different permission levels for agency personnel, from a robust administrator access to just a view access. But what you're seeing there is a result that's automated out of the ERAM X platform that David's proctors use exclusively for this.
So if we're looking at traditional testing versus what we're looking at with virtual instant, give us a side by side. We hit some of them already, but give us a couple more.
But yeah, most people are, using traditional clinic urine testing. I mentioned just some of the drawbacks of having to, find one, go, wait. If it's a reasonable suspicion, the staff has to even drive them there. So now you've got 2 people, out. There's all the collection issues with urine, shy bladder, when people just can't go to the bathroom. That starts a 3-hour protocol that they have to provide a urine sample. All the specimen validity issues, et cetera, can take up to a week to get results. So that's not, that's all real as far as the traditional method. Modern, being able to test on site with instance staff, or even now at home, with this virtual stuff happening is now, available, and you can use trained staff to do it. You don't have to have your staff doing it and worry about their training and how they're interpreting tests and, making sure they're doing things properly under chain of custody. So you can, still do it on site with trained professionals. And because you can do it virtually, it's not like somebody has to drive to you and you don't have to pay, a high on-site mobile collector fee. Oral fluid is compared to urine is nice also because, most everybody can provide enough saliva.
The other one is
Go to the
time
bathroom.
sensitive.
Yeah. And again, with the instant kits, you can get results in a matter of minutes. We do have the ability to continue the process for confirmatory to do the legally defensible drug tests with the screen, confirmation, and MRO all together. So you kind of get the best of both worlds. Screen out your negatives with instant tests that happen in 5 minutes. If it's positive, then you have steps to proceed with the rest of it.
I love it. So a couple of the case studies, I do want to share a couple of these from the results of, so Mary was talking about cost, so that's a concern. Tammy says no concerns. David pretty much laid out seamless process for if both parties are complicit or at least permission based. Accepted by DISA, Denise, accepted by DISA and oil and gas operators. I'd like to learn a little bit more about that potentially. Costs, because of micro distributing, we'll talk a little bit about costs. Getting the test kit to the employee quickly from Brent. Security, Marie. Kimberly's asking about errors. So, the accuracy of the test, and so is, I'm not sure T Calloway is, but, and Allison, are they approved for FDA telehealth home use? Cheating. Let's see. Privacy and the assurance that the connection between the individual's phone and the company is fully operational through the session. That's great. I love that one too. So let's take that for a couple of these. So pre-employment, we went through that. You send it directly to the applicant. This happens on a regular basis, right? You do. Yeah. How many folks? You said you send out a lot. How many do you do this with, David?
With the sending them to their house.
Yeah.
Just on a monthly basis, maybe 300 or 400 are doing it like that.
Okay. And then nationwide with a fleet, take us through, what's the size of the fleet that you're working with?
They have 500 trucks, not DOT regulated trucks, regular pickup trucks. And so they're a little bit unique in that they're one that's doing it this way, but we keep the devices in the vehicle because they could be anywhere in the United States at any given time with an accident, or they may get selected for a random. We've literally done tests at 2 a.m. with people on the side of the road in their truck. So just to kind of give you an idea of how flexible, that can be.
And then also with reasonable suspicion, walk us through this one. For what do you mean? What happened in this?
Yeah, well, there was a company the manufacturing company that had a kind of a company-wide reasonable suspicion incident. I'm not sure all the details if they found, drugs in the workplace or, why they decided to do it this way, but they decided to test everybody. And so we were able to coordinate with them, pretty quickly. We tested about 30 people, all at once. And got it done.
Well, I like it. So we kind of looked at this before. You guys can review this, but you mentioned it's less invasive. So getting to the efficiencies, we do want to talk about cost because I think that came up with a bunch of folks. Let's see. There is a recording. It'll be sent out afterwards. It takes a little time to finalize. You'll get a recap email in a few minutes. I'll tell you about that. Let's see. Can members of an organization be trained as a proctor? Amy wants to know, or do proctors come only from you guys?
We're willing to do it both ways. We'll have to have more conversation about that.
And Renee, I'm sorry, go ahead.
Our biggest concern with that is letting go of the proctoring, the integrity and the consistency of the proctors.
Understood.
So we talk about that.
Rena, how can I get additional information on this process? My agency current contracts with DOI for drug testing. This process seems like it could be done in our medical unit. Yes?
Sure. Yeah.
Yeah.
One thing I wanted to mention, there were some questions a while back about FDA. And so I want to mention that, the FDA, FDA 510K or CLIA waived, all those designations are for clinical testing when the test is used to treat or diagnose. They've issued, FDA issued a 510K exemption for workplace and insurance testing. So I just wanted people to be aware that's what oral fluid drug testing for workplace testing, that's they fall under that FDA 510K exemption. So it doesn't require an FDA 510K for workplace testing. And I think somebody asked about truck drivers. So for DOT, we could not use these instant tests for truck drivers earlier too.
Does that apply to Julie saying, was this approved by DOT?
So the laboratory based test is.
Gotcha.
As far as being able to virtually proctor a DOT oral fluid collection, that's still a little bit to be determined, but I don't believe we're going to be able to do that. I don't think the collection protocol is going to lend itself to the virtual.
The fact that DOT expanded to oral fluid, and I'm going to kind of repeat myself from earlier, was a big validation of the science of oral fluid to be used, period. And 80% of the drug testing across this country is non-regulated. About 20% is regulated DOT.
I have another one. Frank is saying better supply chain, huge compatibility benefits. As Jeff mentioned, I think this is the fastest, most accurate option available, correct?
Correct.
Correct. How about this? Expiration date from date of manufacture from Bill.
They come with two years from the date of manufacture.
And is there only one test which does not include THC?
We have, in the oral fluid devices, we probably have about 30 different SKUs, different drug combinations. You can test up to 12 drugs on a test kit. So we have, 5 panel, 10 panel, 12 panels, some with alcohol, some without. We do have panels with no THC as well. We have a 5 panel and a 10 panel without THC.
Does that make sense, Catherine? That's a great question. That's a great question. And Linda's saying this is a very good training, so you guys are doing okay.
Glad to hear that.
And Julie's asking a concern: accuracy and testers following the instructions. Ooh, putting it to the test. So
that's what the trained proctors are there for. I mean, the integrity, first of all, they've got to, the proctors can cancel a test. They can call it a refusal if they're not following their instructions, because they're going to be told to put the camera in a certain place where they can view the kit at all times in their hands at all times. They're going to inspect the kit. They're going to have to hold it up to the camera, see that there's no tears, nothing in it that's been tampered with. If anybody gets up and leaves, during the test process, there will be, protocol for the integrity of the test. As far as instructing the donors on how to collect, well, I was mentioning, the collection procedure is the key to not having invalids, which are very frustrating. So having a good trained collector on how to administer the instant test and interpret those lines visually, that's part of the training for the proctors, and that's we have very high standards for that. So Yeah, go ahead, Jeff.
The interpretation on those lines too, we've learned through the years. We started out 12 years ago, actually, with specialty courts, veterans courts, drug courts, you name it. And our development it paralleled the things we learned from people that were under court supervision who were going to test this every way possible, if you can imagine. And we mentioned earlier control of the device. It's not just controlling the device. That sounds sexy. It's controlling the environment that the donor is in. We had people that were going into dark rooms, making it hard to observe them and the results of the test. We've learned all those lessons. We haven't just started doing this. But that flashlight that we can turn on, you can also check for cheeking before they even start their test. But it also is very beneficial if the lighting is poor, whether that's intentional or unintentional in the environment they're in. We use a cubed test by design for these virtual tests through micro-distributing. They're flat-sided. And if need be, the proctor can turn that light on to read those lines. So we have very few of those incidents because of being able to control not just the device, but the environment that the test is being taken in. David mentioned integrity. Integrity starts too with it stays inside the camera frame at all times. If they get outside of that camera frame from the time they open that test, we're checking the seal, we're checking the lot number, the expiration date, their ID, everything. But they're given a strict set of instructions to follow by these certified proctors. These aren't minimum wage workers by any means. These are people that have, in many cases, been in the industry collecting for years and years, and now they have a new technology.
I love it. So real quick, key takeaways. It's legal and valid way to conduct drug testing. All the information that you have in the handouts. We do want to get you guys out of here. There's a couple other questions. You guys don't mind sticking around for a couple minutes if they can stay, right? We want to get everybody out of here in the next minute or two so that you can get prepped for your next meeting. And your virtual technology is now a standard way. It's allowable. I love this. Combining the two results, cost and time savings. Hey, if there's anything that everybody's screaming for right now, it's that. Those pieces. And I do want to talk about the cost. Can you talk and think about that for just a minute? I want to let everybody know what's next. I'm going to open up this poll. So if anybody has to get out of here to go, what's next for continuing the conversation? If you have a specific question regarding your agency and drug testing, want to discuss Stat Live, obviously that's good. Stat Live pilot, if you're interested in that, or if you have something else, let us know so that you can get what you need as quickly as possible. As I mentioned before, you're under no obligation to buy from anybody. However, if this is something that you want to pursue, you can order from these guys either directly using J&A language, Joe Fock language. If you're not familiar with that, ask your contracting officer about it. Can be done. And then through partners, through any of the avenues that you need. Get your contracting department. You will get a recap email by the end of the day or early tomorrow. It's a little bit late today. We finalize the Zoom and then we get it up to and disperse that. And you'll get with that presentation. Excuse me, all the docs, video, and if you need a continuing education cert, just there'll be a link in there to ask for it so that you can ask for that, and one-on-one meetings with David and or Jeff to be able to help with that. A couple of things for GovBrief that's coming up. Couldn't be a hotter topic for tomorrow, talking about DOJ requirements for data collection and compilation. If you're interested in that, or would love to pass that on to somebody else, send them to GovBrief. They can sign up there. And then in a couple of weeks, protecting operational technology in federal agencies. So we appreciate that. Any last minute questions? We'll get you guys out of here. And I do have a couple here. Let's talk about cost real quick. David, give us an idea of the cost compared to traditional. Let's just take it from there.
Sure. So, I mean, there's different components to this, and we can bundle it all together, but I'm just going to give it to you kind of unbundled. So you just kind of pay for how you use it. But, a test kit in and of itself is going to be around $4. give or take on the size of the panel. Virtual proctoring itself is going to be around $35, give or take, based on volume. If we have to ship, if we're shipping to someone's house, obviously that adds cost, and it depends on how fast you want it. If you want it overnighted, if you want it, within 3 days, so that can vary dramatically. In those cases, we can do, the virtual proctoring, the test kit, and the overnight shipping in a bundle for, say, around $75 to $80, somewhere in there. So hopefully that gives people a little bit of, idea.
David, if they do decide to warehouse their own kits and buy a volume, and like you said, they have a 2-year shelf life, that
Right.
brings that cost down significantly, because what you just mentioned really is reflecting more of an overnight cost. And
Yeah. So if they buy a box, it's going to be around $125 a box for 25. They keep them on site, and then when they call us to do a test, there'll be a $35 charge.
Julie, give me a thumbs up if that answers your question. How about cost and retail option for local test centers? I think that did it. Hopefully that did for you, Julie. And Jeannie, somebody did ask the question whether or not it's THC. So I'm sure somebody else asked the question and got missed about is this a test that shows immediate users, or is it simply just THC or other drugs that are in their system during the month time frame? And what is the time frame for this? It's more immediate, isn't it?
mm-hmm.
Well, oral fluid, every test method has its pros and cons. Oral fluid, one of the pros is that it's a good indicator of recent use, in that it can detect drugs within a matter of minutes of ingesting. On the backside, it's a little shorter than urine. Most drugs are 2 to 3 day window of detection. With oral fluid, though, marijuana is very short, especially what people are used to compared to with urine. People have heard up to 30 days. With oral fluid, instant technology, you're looking at about a 1 day window of detecting it. So.
And I do want to address the medical card. Julie, can you unmute for a second? You got your hand raised?
Yes. No, sorry, mistake.
That's all right. That's how we roll here. We don't mind putting you right on the spot. All right, fantastic.
You can mute me back.
I'll mute you back. There you go. So Jeannie's question is more about if they use it now or if it was in the month. It's the medical. Hang on a second, Julie. I'm going to do the same thing. Let me put you on the spot. Or Jeannie. I'm sorry, Jeannie. Jeannie, are you there? Can you unmute for a second?
Hi. I'm glad you did that. Thank you.
You bet.
So with Oklahoma having the medical cards, that has caused us considerable trouble. And I'm sure most everybody else is seeing it too. But for us, that medical card means that they technically can have it. We have a drug-free policy. But I would like it to where if they actually could have their card, as long as we know they're not using it while they're on the job. Does that make sense? And so does this test for immediate use, like they use it during those hours of work, or was it within that month? Does that make sense?
Right. Well, the point I just talked about, as far as oral fluid is kind of the go-to way to test for, under the influence kind of test. Most people are, and that's kind of the way a lot of people are going. Even California and I can't remember the other state has laws now in the books that you can only test for the parent drug. You can't test for the metabolite. So oral fluid testing is an approved way to do that testing because it's the technology itself doesn't lend itself for metabolite detection. It's designed and optimized to detect the parent drug because that's what it detects best, which is going to give you under the influence or recent use.
So
It's
that
not,
they are currently under the influence.
yeah, it's not going to give you that they smoked, last weekend.
Yeah, I just want to know, hey, if they're out there and they're going to use a forklift, that they're not high at that moment, and that's
Right.
what caused this situation.
Yeah,
So,
it's the perfect method for that testing. And
right,
then
so if they used it yesterday, it's not going to show up.
I'm sorry, what?
So if they used it yesterday on a non-work day for them, it's not going to show up.
It's nearly impossible for it to show up with the detection.
Awesome.
The cutoff, in drug testing, we look at it as a weakness because we want to detect everything, but to have the 98% accuracy rate that the tests have, the cutoff level or the detection level on these tests for marijuana is around 40 or 50 nanograms. And at that level, it's just for the parent compound in and of itself, it's got to be, it's almost like residual in the mouth, still there.
Within that 24 hours, right?
Yeah. And so, and even sometimes not even the same day. I mean, that's in real world application. Now, if it was positive and you would need to confirm it, obviously, you could obviously let them, put them on leave or something until the confirmation returned, but they would rule out, was that from was that the metabolite or the parent?
Okay.
And the labs only report the parent.
That makes sense,
Okay.
Jeannie?
Very different from other drugs. Most other drugs, where they're looking for the metabolite, that's, the big thing. So that's what's unique with marijuana.
I just think that's incredible. I don't know if anybody else has run into that, but we have, and I have people tell me I'm being discriminatory because I won't let them work with me under a medical card. And so I don't know what to do, but it comes down to our work comp policy and, that we are a drug-free facility.
Right. And the and you've probably found this out, is the MROs, they're not going to do medical cards. They're going to go what the federal regulations are.
Right.
But so that's why it's really important, if you're going to go in there, you got to have it's all going to fall back on your policy. I guess it's kind of the onus gets put back on the employer to decide, how they're going to handle a medical card, because the MROs won't do it.
Right. I still stand on federal, so that's where I'm staying.
Yeah.
Jenny, from your question, it sounds like we have a solution for you.
I absolutely love it, and I love the time frame. That's incredible. Thank you guys for doing this webinar.
You bet.
Thank you.
All right, so we ran over, no shock, but I love the dialogue. That Jenny, you're a rock star for being willing to come up. Thumbs up if these guys help you learn something that you didn't know today. Thumbs up for me
Absolutely.
for sure. Everybody good? If you got to roll, you can roll. If you have any other additional questions, here's the direct, go right to them. Good stuff, guys. You got thumbs up all the way around. Reach out to David, reach out to Jeff. And if you ask for anything, they will follow up with you directly. And if you miss anything, you can always go back to the video, which will be distributed. You'll probably get that, I figure, early tomorrow morning or somewhere tomorrow morning, if that's okay. Guys, great job.
Thank you.
Dave, you touched on it. Just want to reemphasize, we'd love the opportunity to arrange for a live demonstration. David mentioned it earlier in the presentation. If you're anything like I am, I like to see, feel, and touch. And we kind of laid out the background of what we're doing, but it's pretty special to actually see it work. So we would appreciate the opportunity to meet with any and all of you that are interested in a live demo.
Absolutely. Great stuff. I learned a lot. Appreciate you, David. Great stuff. You know your stuff. That's all I can say. I know I learned a ton. I'm gonna shut off. I got the poll done. We'll get you guys out of here. Thanks again, guys, and we'll keep the conversation going. Right?
Thanks everybody.